Hello, this is Dr. Lorenz, Longevity Health Institute here in Rochester Hills in Bingham Farms, Michigan, southeastern Michigan, doing the best in functional medicine. Now, you should already be subscribing and listening to us, and I have to tell you that what I'm about to tell you is going to change your life, make a difference in your life, so that you can make a change before you have to make a change. You can share this with others, make generational impact, and it's very, very, very important for you to listen to this because some of it's pretty simple. So as I talked about in a live video just in the middle of my day, it was published here in Family Practice News. This is also online MedEdge News Network, okay? It was in October of 2023, this just published, is a few articles. One of them though, I wanna tell you the importance of and the risk of cardiovascular disease, so heart disease and stroke, okay, heart attacks and stroke events, which sometimes the very first symptom that you get with a heart attack, unfortunately, is death. Okay, not everybody gets chest pain and shortness of breath and radiation down their arm or jaw pain, etc. So long story short is when you have autoimmune disease, you have a big immune inflammatory reaction in your body. Your body's angry, and when that happens, you can actually get a lot of effects on the vascular system and the endothelium, which is the vessels. And in a study, okay, a multitude of peer-reviewed studies, double-blinded, many reviews, okay, in here reported anywhere between 7 and 50% increase in cardiovascular disease found in people with a autoimmune disease. Now, why such difference between 7 and 50? Well, some psoriasis, lupus, MS were worse than eczema or asthma, which is a form of an autoimmune condition. But some autoimmune conditions had upwards of a 50% increase. That's huge in a lifetime of cardiovascular events. So if you have out there any autoimmune disease, which would be Hashimoto's, eczema, lupus, MS, rheumatoid arthritis, psoriasis, psoriatic arthritis, ulcerative colitis, Crohn's, argumentatively you could even say food allergies have some autoimmune component, which often leads to an autoimmune disease, starts with function and then leads to disease. But again, take this very seriously, get tested, get cardiovascular tested, get biomarkers related to your cardiovascular system, whether it's get a vascular stress image, CT calcium score, CT angiogram, Dopplers, endopaths, which look at vascular blood flow, but look at your vascular system in depth and get actually a qualified functional approach, kind of like what we do here in a deep dive wellness preventative medicine, so that you know that you are good because you're focused on autoimmune conditions, you're focused on all these symptoms you have, and often some of them can be mixed, and I've seen this here before a few times, can be mixed in your autoimmune plethora of your symptoms, but it's a cardiac symptom, okay? So that's one thing that was in this. Also in this Family Practice News was an article on the incidence of breast calcifications preceding cardiovascular disease. So you've heard of cardiac calcium scores where we lay down calcium in the endothelium of the artery, so in the vascular wall, but anytime you lay calcium down in your body, in your chest wall, we call them we call them pulmonary nodules, pulmonary calcified inflammations. We call them phleboliths in the pelvis, in the breast. Again, these are calcifications that have a slight risk in breast cancer. Even though they say you look normal, but there's some calcified areas in the breast, get your heart and vascular system checked out. Get your carotids checked out, get your heart checked out, get labs that look at your endothelium and your inflammatory markers and your cardiac risks, because you may be at risk and not even know it. And it's very common, women in their midlife, 45, 50, 55, 60 and on to develop breast calcifications. The other interesting thing, again, in Family Practice News, I always think about and look at it from a functional a wellness preventative place. But there's an article in here about placebo-controlled, double-blinded, over 30,000 individuals in a study. The turmeric root, the turmeric supplement, which we use here often, the extract of turmeric called curcumin, was just as good, just as efficacious as omeprazole, which is a PPI for stomach acid and heartburn. So millions and millions of scripts are written, okay, and have side effects because you can get nutrient depletion, magnesium deficiency, you can get bone loss, you can lack many of your nutrients absorbed when you take a PPI, when you don't fix your digestive problem. In simply using, and actually it's a very small dose, 250 milligrams 3 times a day of turmeric, actually had the equivalent, if not better than, taking for heartburn and reflux and that, a PPI like omeprazole. So what's the take-home message here, and why would that work? Well, the reason it works is because a lot of acid reflux, dyspepsia, heartburn, and things like this are foods that cannot be digested, and we lack acids. We lack the production of pancreatic and hydrochloric acid to break those down and absorb. Okay, so taking something like that, often curcumin and turmeric and even other bitters, okay, in the bitter family, herbs and that, they stimulate acid production and enzyme production, so you break food down and it passes quicker and more efficiently. So I like that because you know me, I always like natural fixes and look at why and alternatives. So what's the take-home message? Get off your PPI. Here we always fix your gut. One of the first things we do in our functional model and looking at a systems approach is always fixing the digestive system. Almost first, always, okay? You gotta fix the gut. Do all these esoteric, all these great treatments we have and all these things, they're great, but you gotta fix the gut and do the right thing with your diet and gut. But again, pay attention to inflammation and immune conditions because they're directly linked to cardiovascular conditions. So listen, send us messages, contact us, come in. We take new patients all the time. We run a multi-systems approach here with different approaches for everybody here. Okay, we have many practitioners and physicians like myself that do the best in functional deep dive medicine to give you the best in healthcare, solving goals, okay, giving you the best in helping you thrive, but also doing the best in prevention and wellness. Thinking not just now, today, but decades ahead to make a generational impact. Now do the right thing, share this, and be well.